These are not new issues. They're the same ones Sidney Garfield and Henry Kaiser faced during the Great Depression and World War II. But while others talked about healthcare challenges facing America, these two men began taking action. Sidney Garfield was a doctor. Henry Kaiser was a builder. Both were visionaries and innovators. Dr. Garfield was experimenting with a model that blended prepayment for medical care with an emphasis on preventing injury and illness. Kaiser wanted to improve medical care for his workers, to keep them healthy and on the job. The pair joined forces at the biggest dam ever built, Grand Coulee, in 1938. Garfield focused on a simple insight. Doctors had things backwards. They got paid only if people were hurt or sick. Prepaid health care, he reasoned, could turn that on its head. Doctors working in groups could be paid to keep people well and treat them when needed. Providing services under one roof, as Garfield put it, could make care more efficient with better results.
There was a change in the severity of illness. We no longer saw terminal pneumonias, we saw early pneumonias. We didn't see very many ruptured appendices, we'd see early appendices. And diphtheria entirely disappeared.
The Kaiser Permanente model was born. When America entered World War II, Kaiser's legendary shipyard workers on the West Coast smashed records for shipbuilding. Dr. Garfield set about keeping them well by building the largest civilian medical care program on America's home front. Henry Kaiser was the passionate advocate.
I can't understand for the life of me why there should be any conflict or controversy over any plan that brings comprehensive, high-quality medical care to Americans at a low cost.
Soon, the nation's eyes turned toward this innovative new idea. After the war, Kaiser and Garfield opened Kaiser Permanente to the public, staying true to Garfield's original vision. It rapidly grew into the largest system of its kind. Garfield, always looking for ways to improve care, understood that a patient's medical information was essential to the doctor. In 1960, he saw the potential for computers to transform the practice of medicine and asked Dr. Morris Collin to lead Kaiser Permanente in groundbreaking work on the electronic medical record.
I think the time has come for us to use computers to help physicians take better care of our patients.
Soon, Kaiser Permanente became one of just a handful of places in the world where physicians and scientists were collaborating to pioneer the new field of medical informatics. Again, Dr. Garfield was ahead of his time. Today, KP Health Connect is the largest privately funded electronic health record in the world. With real-time data and complete connectivity, we can ensure care teams can access critical medical information to improve quality of care. These data capabilities enable connectivity for our members, too. My Health Manager on kp.org gives patients safe, secure access to their doctors and their own health information when and where they need it. Kaiser Permanente continues to be guided by the original vision and values of its founders. The Sidney R. Garfield Healthcare Innovation Center tests and refines new ways to do things better. Clinical researchers explore the frontiers of science to help implement and use health informatics, manage chronic illness, and support people in taking better care of themselves. Health improvement programs help members stay well, with people engaged to eat healthy foods and maintain essential and healthy levels of activity, with walking at the center of the activity campaign. Farmers markets at hospitals and clinics provide people with easier access to fresh fruit and vegetables from Honolulu to Washington, D.C. Biking, hiking, and walking paths are built where there were none. a new national campaign encourages people to walk for fitness and health. In short, Dr. Garfield's most ambitious dream, what he called total health, is put into practice every day. As Dr. Garfield once said, good health is a way to get more out of your life. More energy, more enjoyment, more potential, more purpose in life.